welcome back in the channel of Clinical Care Insight. We started a series of lecture on the sensory system, and we are studied already about these special sensory organs, okay? And the last part we covered about the eye structure, then about the ocular muscles, their movement, okay? Then we seen how the physiology of vision is done by the photoreceptor cells, okay? And we are left with the one topic, that's a blood supply of eye. I am taking it separately because this is clinically very important, okay? There are diseases, okay, which target this blood supply of eye and result into the blindness primarily, and there are other conditions as well, okay? So we will discuss in today's class all these things. So here is our today's lecture outline. We will first deal with the blood supply of eye, clear, then blood ocular barrier. See, in our, you already studied it, that blood brain barrier, okay? In the central nervous system there is a one barrier which prevent the unwanted things to go into the neuronal environment, because neurons love to have their steady environment, okay? They want to maintain their microenvironment perfectly. So nature will provided a one kind of physical barrier, okay, by which the substances which is present in the blood all are not allowed to go. Some are selectively approach, okay? They are highly selective barrier. Same barrier is also present, okay, in the case of eye, okay? We will see that this blood ocular barrier, there are two types, okay? There are two types. Then we will see at last about the vascular disorders of the eye, okay? Vascular disorders of the eye, understood? So now first begin with the blood supply of the eye. Now my question is, see, blood supply is needed, isn't it? It's a needed for each and every organ, okay? But for the case of the eye, we studied that there are layers of the eye which are avascular, okay? Which are avascular, okay? But you know, like in spite of having those avascular, you can say the structure layers of the eye, I need a plenty amount of blood supply. I need a plenty amount of blood supply. So most of the eye blood supply is done, as you know it already, about the ophthalmic artery, okay, by the ophthalmic artery, okay? Most of the arterial blood which goes to the eye, goes by this artery, that's called the ophthalmic artery, understood? But you know, understanding superficial is not enough. We have to delve with depth. No, let's understand. See, you know, you have a heart, okay? See, this is your left atrium, okay? From the left atrium there is arises of branch of aorta, okay? This is basically a aorta. In the aorta there is a 3 artery, and there is one. This artery is your subclavian artery, okay? Subclavian artery, okay? And this one is brachiocephalic artery, and there are two artery, okay? There are two artery which goes to the higher system, and these arteries are called as carotid artery, okay? These are your two carotid artery. Now you understand it? This is, I don't just one chamber of the heart. Okay, that's your right atrium, and from the right atrium there is a branch of aorta. Okay, one is your branchiocephalic artery. The one artery is a branchiocephalic artery, another artery which is your carotid artery, and one is your subclavian artery. Understanding? Now what is happening, these carotid artery they goes to the higher system. Okay, they goes to the higher system. Suppose, yeah, this is anterior surface of head. Okay, and this internal carotid artery, okay, carotid artery, they goes to supply the brain. Okay, this is your foramen magnum, okay, they are going to supply the, you can say, the head part. Okay, internal carotid artery, carotid artery, okay, this is carotid body, and now this carotid artery is called as internal carotid artery. Are you following? It's the internal carotid artery. I am showing you how from the heart, how this artery is going to supply the higher systems, including your eye. Okay, understanding? Now, these artery, they goes, and you know there is one structure, okay, for venous drainage. There is one structure present here in the cranial fossa. This is one structure present here, and this structure is called as, yeah, can you name it? Yeah, very good. It's a cavernous sinus. It's a cavernous sinus. See, the cavernous sinus is a, you can say, the venous drainage system. Okay, it's like a hub. Okay, hub of venous drainage. All the venous drainage from the, you can say, the skull region, okay, and the retinal region and all the facial region, they drain into the cavernous sinus, and via the internal jugular vein. Okay, from the cavernous sinus, internal jugular vein through the neck region, they come into the superior vena cava, and they drain into the left atrium. Very good. Right atrium. Okay, they drain into the right atrium. Right, not atrium. Right atrium. Clear? Understood? Till here you have any doubt? Yeah? No? Shall we move ahead? See. Now, when this artery comes here, okay, there is a one foramen. Okay, there is a one window, or we can say the foramen, and this foramen is called foramen of Lashram. Understanding? No problem. Now these artery, okay, internal carotid artery, they goes to the lateral wall. Of cavernous sinus, and this is your eye. Okay, this is your eye, and the internal carotid artery via the foramen lustrum, they go to the lateral wall of cavernous sinus. From here, they given one extremely, you can say, the important branch. Okay, this is called internal communicating artery. For the they giving the branch for the brain. Okay, internal communicating artery. This is anterior cerebral artery. Okay, and they also give one branch. Okay, they also given one branch to the eye. From here, they also giving one branch to the eye, and this is called as ophthalmic artery. Understood? This is called as ophthalmic artery. Understood? Now, story not end here. Story begins from here, because we are studying the blood supply of the eye. See, ophthalmic artery give one important branch to the retina of the eye, and this branch is called as central retinal artery. This is called as the central retinal artery. Are you getting? Yeah. Then they given another branch also. Okay, they given one branch. This is called the anterior ciliary branch. Okay, one branch directly given to the ciliary. This is called as the ciliary branch. Understanding? And one artery, they are also giving the one branch, that is called as the posterior ciliary artery. Okay, posterior ciliary artery. Now, understand the story. From the heart, okay, from the arch of aorta, there is a one carotid artery which is arising, and they are going to the, you can say, the lateral exterior to the foramen magnum. There is the one lustrum, that's called the foramen lustrum. Okay. Now, through this foramen lustrum, they goes to the lateral wall of cavernous sinus, and from here they are giving the branches to the higher system, like the anterior commissure artery. Okay, this is anterior commissure artery, posterior, write down, posterior communicating artery and anterior communicating artery. These are making the circle of Willis. Okay, these are going to make the circle of Willis inside the central nervous system. Okay, which is a one kind of blood supply for the central nervous system. Okay, and this is also giving one branch to the eye. Okay, one branch to the eye, and that is called as the ophthalmic artery, the main branch. Okay, and from the ophthalmic artery, there are one extremely important artery which is going to supply the retina, that is called as the central retinal artery. Apart from that, this ophthalmic artery also given the branch to the ciliary muscle, like anterior ciliary branch. Okay, then posterior ciliary branch, and then ciliary branch. Now, the anterior ciliary branch, they are going to supply the cornea. See, the anterior ciliary branch, they are going to supply the cornea. Okay, the ciliary branch, they supply the retina. Okay, sclera, and also supplies to the cornea. Carotid, we can say the carotid supply. Yeah. Are you following, understanding? No any problem? See, These arteries, they are very, very important. These arteries, especially the supplying arteries, okay, you can say the branches of ophthalmic artery which is given to the various part of the eye, they are clinically important. How? I will tell you. First, you clear with this diagram? You have any doubt? Yeah? Let's summarize it once again, that from the heart, okay, from the heart there is arises of the aorta, and from the aortal head there is arises of the, you can say, the carotid artery, okay, then carotid body, and then there will be a internal carotid artery. This internal carotid artery, through the foramen of flexure, they are going to the lateral wall of the cavernous sinus. It is a main venous drainage, okay, from eye. See, arteries are not only going to the eye, no, from the eye there will be a veins, okay, which have to drain, okay, which have to drain in this cavernous sinus, and from the brain, okay, from this central nervous system area, there are other branches given by this carotid artery, okay, given by this carotid artery, and from here also there is a venous channel which is drained into this cavernous sinus. So you can say it is like a hub of the venous drainage, okay, and from this there will be a internal jugular vein. They drain into the internal jugular vein via the neck region. They come into the superior vena cava and they drain into the, we can say, the right atrium, okay, right atrium. Understood? No problem. Let's move ahead. On the way they are giving the one branch that's called the ophthalmic artery, okay, which is a main artery for the eyes, one of the main artery of the eyes. Now this ophthalmic artery, they are giving the one important branch to the retina, that's called as the central retinal artery. Understand? Then they are giving one branch that's called the anterior ciliary branch, which is supplying to the cornea. Then they are giving the one more branch that is called the ciliary branch, which is supplying to the retina and sclera. Understood? And then they are giving one more branch that's called the posterior ciliary artery. See, the posterior ciliary artery, they are also supplying the choroid, okay, posterior ciliary artery, they are also supplying the choroid. No problem? Okay, shall we move ahead? Yeah. Now once you understand the blood supply of the eye,